This is considered a very basic introduction to pharmacology, and we'll talk about certain drugs and their influencing effects on certain organ systems. We'll start off talking about the central nervous system, which consists of the brain and the spinal cord. And the four main classes of receptors that we'll talk about are the GABA receptors, glutamate receptors, dopamine receptors, and the opioid receptors. For example, the GABA receptor, which helps to potentiate the entry of chloride within the cells, helps to stabilize the cell membranes and promote either sedation or the reduction of anxiety. And certain drugs that we use to stimulate the GABA receptor, we'll talk about in greater detail, include benzodiazepines, barbiturates, certain IV anesthetic agents such as propofol and etomidate, stimulate the GABA-A receptor and therefore allow the entry of chloride into the cell in hopes to stabilize the cell membrane and promote sedation. On the opposing effect is the glutamate receptor, which has an excitatory effect on the central nervous system. Glutamate stimulates the entry or promotes the entry of calcium and sodium into the cell and the exit of potassium out of the cell, which stimulates depolarization and therefore excitatory influence on the central nervous system. And one example of a glutamate receptor is NMDA. And NMDA is actually antagonized, and ketamine antagonizes the effect of the NMDA receptor, and therefore ketamine is also used as an IV anesthetic induction agent in the sense that it promotes sedation. Then we'll talk about the autonomic nervous system in the sense of the parasympathetic tone and the sympathetic tone. And we'll talk about how these parasympathetic and sympathetic tones affect primarily the cardiovascular and the pulmonary systems. So the cardiovascular system, if you look at the SA node, contains the muscarinic 2 receptors and the beta 1 receptors. And we can think of it as the muscarinic 2 receptors decreasing the cyclic AMP, and the beta 1 receptors, when stimulated, increase the cyclic AMP. So therefore, the parasympathetic tone stimulating the M2 receptors, decreasing the cyclic AMP, and promoting the exit of potassium out of the cell, tends to decrease the heart rate. And therefore, the parasympathetic tone on the heart will decrease the heart rate. Opposed to the sympathetic tone, which stimulates the beta 1 receptors on the SA node, increasing the cyclic AMP tends to increase your chromotropic, which is the rate of the heart, your dromotropic, which happens to be the conduction within the heart tissue, and the inotropic effect, which is the contractility of the heart. We'll talk about all these in greater detail in the sense of which G protein is being stimulated, what happens to the adenylate cyclase in the sense of increasing or decreasing the cyclic AMP. We'll talk about the ion exchange that takes place within the cell membrane, and what physiological effect does it have on the cardiovascular system. Another effect on the beta-adrenergic receptors, for example, beta 2 receptor, which happens to be within the the smooth muscle tone within the pulmonary airway, the respiratory airways. And we can think of smooth muscles coiling around this airway. And when there's a increased resistance of the smooth muscles, meaning contraction of the smooth muscle, it constricts and promotes bronchoconstriction and therefore increases the airway resistance that takes place within the respiratory system. And if you were to stimulate the beta 2 receptor and increasing the cyclic AMP and ultimately increasing the calcium concentration, this promotes smooth muscle relaxation within the airways and therefore promotes bronchodilation and therefore decreases the airway resistance. And this is an example of the treatment for asthma, in which when you give albuterol, it stimulates the beta 2 receptors and therefore promotes bronchodilation. Then we'll talk about the renal system and the certain medications that promote diuresis. For example, we'll talk about the osmotic diuretics such as mannitol. We'll talk about loop diuretics, for example, furosemide, which binds to the chloride binding site and prevents the reabsorption of sodium and chloride and that also promotes diuresis. We'll talk about thiazide diuretics, and we'll talk about the hormonal effects as well, such as aldosterone, which is released from the adrenal gland, and we'll talk about the antidiuretic, which is released from the posterior pituitary gland. We'll also talk about certain muscle relaxation medications that's used during general anesthesia. For example, depolarizing muscle relaxants such as succinylcholine, which promotes the fasciculation of the cells within the muscle. And we'll talk about the non-depolarizing muscle relaxation medications such as cisatracronium, atracronium, and a whole list of other medications which we'll talk about in the next lectures that promote muscle relaxation, that promotes the helps with the assistance of surgery. For example, abdominal surgery, where the surgeon requires muscle relaxation in order to do abdominal surgery. Then we'll talk about the metabolism and the biotransformation of certain drugs and the phase 1 and phase 2 reactions in order to inactivate the molecule. And then through the phase 2 reaction, we'll try to make it more water soluble so that these molecules can be excreted via the kidneys with the urination. Then we'll talk about the coagulation system and certain medications such as Coumadin, heparin, and low molecular weight heparin such as Lovenox. And we'll talk about the effects on the coagulation system. And we'll talk about this all in greater detail in the next lectures. And we'll talk about which receptors are being activated, how to block the receptors, how to activate the receptors, and what physiological response is taking place within the body with each class of medication.